Good morning, everyone. Now, let us discuss the new topic, that is the rest and rest seat. Okay, so let us discuss one definition for both of them. Okay, the definition of rest: it is a rigid extension. It is a rigid extension of a removable dental prosthesis that used to prevent movement towards the mucosa. And what it will do, when it will prevent, it will transmits the force to the teeth. Okay, now come to definition for the rest seats. Rest seats, these are prepared space. Okay, we should not write it as space, we can write this another name is the recess. Prepared recess in a tooth or restoration. For what? To create, for creating occlusal, incisal, cingulum rest. Okay, this is the definition of the rest and the rest seats. Now we will see the functions of the rest and also the functions classification of the rest. So these are the two topics related to the rest and the rest seats. And now functions, what are functions of rest? Okay, as we know, first of all, we will be knowing for everything it has one proper function, that is support. Okay, the primary function of the rest is to support the RPD. And also here we have said that force, it will transmits the force to the teeth. So transmits the force, this is the second function. So it will transmit the force, where it will transmit along the long axis of the teeth. Okay, along the long axis of teeth. Next, another one more function is indirect retention. Indirect retention, for what purpose? For the retention purpose. And it is the rest are position, this the rest which is present, it may position anterior if not posterior to the axis of rotation. For to for what purpose? Indirect retention, it has fixed because to prevent the unsupported distal extension denture base from the lifting away from the edentulous ridge. Okay, to prevent the unsupported ridge, unsupported distal extension denture base from lifting away. Okay, whatever the distal extension it is there, it is unsupporting, so we want to prevent from lifting. Okay, and one more function of this is the positional maintenance. So we are maintaining positional maintenance. For what purpose? For maintaining the clasp assemble. When there is a proper clasp assemble, it will works in a proper function. And one more function, it is the stability. So we know the clasp which is there best, this is the clasp. Okay, this is the clasp, the thickness and the position of this clasp, it will generate some horizontal forces. These horizontal forces, it can be generated during its function and thus assist its stability of the denture with either component of the RPD. But in case of the distal extension cases, in distal extension case of the RPD, the this seat which is there, it should be shallow or saucer shaped, shallow or saucer shaped, and it should be moved like a ball and socket joint. Okay, this is the function of the, this is the function of rest. And one more function, it is the establishing the occlusal plane. Okay, establishing the occlusal plane. So this rest helps in establishing the occlusal plane in relation with tipped molars. In case of tipped molars, it will be helps. And occlusion only rest is designed to establish more acceptable occlusal plane. And one more thing, and seventh one is the prevention of foot impaction. So this is the edentulous stretch. The abutment teeth which is present, it is more prone for the foot impaction. The rest which is placed to the edentulous space, it will prevent. So if we are placing any rest here, it will prevent the foot impaction of this abutment teeth. And the prevention of, and the eighth one is prevent tooth migration. If there is edentulous space, if it is the smaller edentulous space, it is difficult to restore the curves discontinuously of the arch and causes tooth migration problem. So if there is edentulous space is smaller, if there is smaller edentulous space, it will causes the tooth migration. So when we will place the rest, it is placed on the edentulous space, it will prevent the tooth migration. And one more, reciprocation. What is this reciprocation? The planned design of rest along with the minor connector. It will be this. So this rest which we are placing, we will be having the proper planning and all. So we are placing this rest along with the minor connector. So when we are placing this rest along with the minor connector, it will it reciprocates stresses that can be generated by the retentive arm of the clasp that will be assembled on the abutment tip. So this is the abutment tip. This is the edentulous. So we have placed one rest along with the minor connector, and what it will do, it will be generating some stress by the retentive arm. It has some retentive arms. Okay, it has some retentive arms, and this retentive arm, it will produce some stress, and then it will produce some stress, then it will reciprocate the stresses, okay, that can be generated by the clasp. Okay, next come to classification. So this classification, that was based on, the one is based on relation, another one more, it was based on area, based on the area. So based on the relation, it is primary if not secondary. And here based on the area, it is divided into occlusal, incisal and lingual or singular.